What we've been doing today is seeking the detail from different sectors within the workforce, from the bus drivers in Unite, from the transport workers in the RMT, from the school sector, from the Prison Officers Association. So we've been discussing, and of course not forgetting the shop workers, so we've been discussing issues and inquiring if these experts who work on the pick point about violence in the workplace, the violence which is being received by members of the trade union movement, many who are low paid, they receive abuse, they receive violence on an almost day-by-day basis. So the whole idea of the day's session was to get people together, and we ask them the questions, they give us the information they've got, we'll prepare a report, and then people will actually see for reals what's happened in the workplace in the different sectors.
This is simply not an operational issue, it's a health and safety crisis. And it engages clear legal duties that the state is currently failing to meet. Parliament has the power to change this trajectory. Assaults in prisons have reached record highs, with violence continuing to rise across the estate in all areas: female, young offenders, high security and Category C estate. The number of serious assaults on staff remains unacceptably high, with officers reporting increased use of improvised weapons and unpredictable violence. These figures are not abstract. These are real, and it's real people. Officers and prisoners are harmed in environments that are supposed to be controlled and safe. We probably all heard of the record of the high-profile incident that happened last year. One at Franklin, where the Manchester bomber Abedi assaulted 4 members of staff by throwing hot oil over them and stabbing them with improvised weapons. We also heard the incident at Belmarsh, whereby Axel Radabakana assaulted a member of staff by throwing boiling water over them. We hear about these, but these assaults are happening every day in our prison estate. Just over the last 5 days in England and Wales, there were 5 incidents of staff being spat at in the face at Park, Aylstoke Style, Forest Bank and Lancaster Farms. A member of staff at HMP Tameside in the private sector was punched and bitten by a prisoner. A member of staff was punched at HMP Loudon Grange, required hospital treatment. At HMP Wood Hill, 2 staff were injured after one was head-butted and another was bitten. HMP Ewell, a member of staff was kicked and punched by a prisoner, required hospital treatment. At HMP Old Course, a female member of staff was sexually assaulted by a prisoner. In another instance at Old Course, a member of staff was punched and another was spat at. At HMP Dovegate, 2 members of staff were assaulted in an instance, one by having hot water thrown over them and the other being bitten. At Belmarsh, a member of staff was bitten by a prisoner. At HMP Fossway, a member of staff was assaulted by having urine squirted in their face. At HMP Pentonville, a member of staff was punched, requiring hospital treatment. In another instance, a member of staff was spat at. At HMP Bristol, a female member of staff was sexually assaulted. And at HMP Chelmsford, a member of staff was assaulted by choking. This is all over the last 5 days. But why is violence rising? I would say that understaffing is the biggest single driver of violence. When wings operate with dangerously low numbers of staff, staff become isolated, making them easy targets, unable to intervene early enough. Regimes collapse and prisoners are locked up in their cells for excessive periods, increasing frustration and aggression. Many prisons are also operating far beyond their operational capacity. Overcrowding increases tension and conflict, reduces access to the regime and purposeful activity for prisoners who are located in them establishments, and this places impossible pressures on staff. The rise of drugs and organised crime in prisons has transformed behaviour. With extreme, unpredictable violence, prisoners experiencing psychosis because of the drugs they're using, and organised crime groups using drones and intimidation to control supply. In addition, there's also a significant proportion of prisoners that have complex mental health needs, and without adequate clinical support, officers are left to manage these crises that they're not medical trained to handle. Violence in prisons is not only a moral failure, it's a legal breach. Under the Health and Safety at Work Act 1974, the state, as the employer, has a statutory duty to ensure, so far as reasonably practicable, the health, safety and welfare of employees. This should include prison officers, but it doesn't. Provide safe systems of work. We have a prison regime that repeatedly exposes staff to violence. This cannot be considered safe. Conduct suitable and sufficient risk assessments. The current levels of violence demonstrate that the risks are not being adequately controlled. And to provide adequate training, staffing and equipment. Understaffing and the lack of protective equipment directly undermines these duties. And the final duty on the state is to protect non-employees affected by work activities. This includes prisoners and visitors who are increasingly being assaulted themselves. But what can the POA do about it as a union? We can raise it with our employers on our weekly council meetings, and we can attend events like this where we highlight the violence that our members and prisoners are facing. But we cannot use our industrial muscle because we're banned from taking industrial action because of the pernicious legislation of the Criminal Justice Act. But when violence becomes normalised, the employer, in this case the state, is failing in its legal obligations. This all has an impact on staff. We see rising levels of PTSD and trauma among staff, increased sickness levels, experienced staff leaving the service, and recruitment unable to keep up to pace with the resignations. And this all has an impact on prisoners and public safety. We heard earlier on that in schools that unruly cannot educate. Well, prisons in the same way that are violent cannot rehabilitate. What we're seeing is higher reoffending rates, greater instability, increased long-term costs to the taxpayer, and the revolving door of crime that spills back into the communities. The safe prison is the foundation of a safe society. The POA is calling for investments in the workforce, including safe and decent regimes, competitive pay, improved pensions and reduced retirement age, professional training and mental health support for staff. The POA is also calling for a national strategy on prison violence, and the Royal Commission is the criminal justice system, which would be a coordinated approach addressing drugs, gangs, mental health, overcrowding and infrastructure decay. Violence in prisons is not inevitable. It's the result of political choices, and it can be reversed by political will. The POA is calling on Parliament to meet its legal duties under the Health and Safety Law to protect our members so that they can protect the public. Our members have the courage to deliver this change, but they cannot do it alone. Thank you.
This is such an excellent session, so I should declare my interest. I sit on the Justice Select Committee, and so overcrowding in prisons and drugs in prisons is a major issue that we've been dealing with. So the Select Committee has recently prepared a report on tackling drugs in prisons. So I'm just going to ask you a very direct question. So you've said that the problem is due to political choices rather than it being inevitable that we've got these problems. What would you want the government to do in terms of making things better? So I mean, we've visited lots of prisons, and what you say is actually, it's reflected in what we've seen. We will have high incidences of prisoner absences because of attacks and because of mental health issues. How do you think that the government should be dealing with those problems of overcrowding and drugs in prisons?
I would like to see an expectation of manageable regimes that are safe, decent and secure for staff and for prisoners. I'd like to see purposeful activity provided for prisoners, which actually educates and rehabilitates and will probably improve their chances of not reoffending. I'd like to see increased staffing levels. When I left the prison service, I was a manager at HMP Risley in Warrington, and one of my jobs was to manage the detail. So I'd have usually 105 staff on duty for 1,100 prisoners. If I had to send one prisoner out because he'd had a heart attack or he'd been assaulted, or for whatever reason he had to send the prisoner out to hospital for an emergency escort, I would have to lock up a wing because the staffing was that close. Because I'd have to take 2 staff off a wing so they could escort this prisoner to hospital. But then I'd have to lock up a wing because there's no spare staff in the system. And it's just an absolute joke. things like mandatory drug testing, searching and whatever, they're what's known as flexible tasks. They don't happen because we haven't got the staff to do them, and other things are considered more important. That's what I'd like to see a change.
I ought to declare an interest as well, Mick. As you know, I've acted for the POA on many occasions, particularly over the right to strike and in relation to understaffing and so on. Apart from the issue of underfunding, overcrowding and understaffing, can you tell us what training prison officers have to handle violence from prisoners? I know there's a degree of special training for special officers, but what's the general level of training?
Yeah, currently new prison officers will receive 6 weeks of training, and as part of that training they will now be trained in CNR, or a new thing which now we have, which is called SPEAR. SPEAR is more or less concentrated now. So in the past, control and restraint would be where one member of staff would take the right arm, one member of staff would take the left arm, one member of staff would protect the head, and then we'd move the prisoner safely using them techniques. We've now introduced this, a control and restraint technique, which is called SPEAR, and it includes stuff like preemptive strikes and stuff like this. But actually, me being the cynic, with SPEAR, when you use SPEAR, you don't need 3 staff. So you can do that on your own. So that's why it's been introduced, in my opinion, because actually there are a lot of places now we've had out lone workers. There are a lot of places within the prison where staff may be a lone worker and they can't use CNR because they haven't got 3 staff, but they can use SPEAR. So yeah, to answer your question, usually about a week's of initial training, and they'll be refreshed every 12 months as well.
Thank you for your contribution. I thought it was extremely eloquent and to the point. But one of the messages I've taken is a bit like the message from Darren about schools, about how can we rebuild that concept of the team around the child, which takes resources. Well, it seems to me that the team around the prisoner, education, mental health support, all the other essential services that would help stop or curb repeat offending and help rehabilitate, I can't say that word, rehabilitate people to become useful members of society. That there's a clear message from you that in addition to everything you've described directly impacting on prison officers, there's a system issue which is about needing more resources and needing that team to be able to work together again.
It's 100%, and a lot of our job is partnership working. So we work with probation, we'll work with social workers, we'll work with housing people and so on and so on. When I was a prison officer, I quite often got involved with speaking to housing associations to get a prisoner accommodation when he's released. I've spoke to job centres to make an appointment with them so they can go and get a job when they're released. That's far from what happens now, because all that happens now is prison officers are running around chasing their own tail because there's not enough of them, and all they're doing is unlocking and locking up prisoners, and that's the difficulty.
I think just briefly, the last question to you is, you mentioned the issue with regards to complex mental health needs for prisoners. I mean, again, what people generally say is that lots of prisoners in prison who really need to be in mental health, a mental health environment rather than being in prison. How relevant is that argument?
How relevant is that to what, sorry?
How relevant is that argument that there's lots of people locked up in prisons who really shouldn't be there, they should be in mental health institutions for want of a better term? Yeah,
so I think it goes back historically to where care in the community was introduced and a lot of the mental institutions were taken away. And what we've seen then was that a lot of them people who were in mental health institutions were diverted into prisons. Initially within prisons we had very, very little mental health support for prisoners. But more recently, we have seen mental health nurses introduced in prisons, but that is not sufficient. As I say, I worked at Risley, we had 1,100 prisoners. When I was there, we had one mental health nurse who looked after a caseload of probably 200 prisoners. And then we'd have a psychiatrist come in every now and again. But it then gets to the point whereby a psychiatrist will see a prisoner and say, right, okay, this person needs to go to a mental health facility. And they'll say, right, okay, we'll make the arrangements for that person to go. And 3 months later, they are still in a prison and they're not receiving the treatment that they deserve and they need. So yeah, it creates a problem, not just that initial sentencing where a judge can't send them to a mental health facility, but actually post-sentence where they're in an establishment and you realise there is a problem. We can't move them because there's no space and them facilities are not there.
So thank you very much to everybody. Thanks to Shelley and her team. Thanks to my colleagues in the Commons and in the Lords for their attendance. And it's been really, really helpful, and I look forward to the report. Thanks very much. Thank you. Thank you. I think Mick Pimblett and the rest of the team at the Prison Officers Association did a fantastic job under the most grim of circumstances. I mean, we discussed the drugs in the prisons, the undermanning in the prisons, the violence in the prison, not just prisoner against the employees, but prisoner against prisoner. It's a massive issue, and Mick was able to explain the situation to the members here. Again, very invaluable, a great source of information about how ordinary people trying to make a crust suffer in everyday terms as part of their employment.
I know Mick Pimblett been fighting that for years, isn't it?
I mean, it's just, I don't know what you do, but things have got to change.
Shop workers, why do you go on?
It's important to get people from the different parties who can come together, who've got a common understanding of what's happening in the workplace and who seek to educate themselves and their parties from the people. As I say, I use the terminology at a peak point, in the shop, on the factory floor, all means the same sort of thing. So we get together and we've got a common objective, and that's to highlight these issues and hopefully change people's views on it and get better legislation, for example, with regards to protection of people in employment.